It's gonna start. Okay,
Oh.
all yours, Ms. Bree.
Okay, all right. Well, it's 1:01 and let's go ahead and call this meeting to order. We can first start with the review of the agenda. And if there's any additions or changes, just let me know. Okay, seeing none, we can move right into minutes. Please take a minute, review the minutes, and if there's any changes or additions, please let us know.
And Bree, can you confirm that you do see the packet on screen?
Yes, I see the agenda.
Okay, perfect. Thank you.
You're welcome. Anything? Okay, hearing none, we can just go ahead and approve the minutes from the May 22nd meeting. And then we can move right into our action items, which is the appointments for the Board of Health officer positions. Because this is my last meeting and there's Dr. Bedell isn't here, but he is finished through serving his term as well as vice chair. So we did some emailing and reaching out, and it sounds like we've got a couple people that might be interested. I'm hoping I talked to Shannon and you said you'd be interested in taking on the position of chair. So I would like to nominate you as chair of the Board of Health. And I was wondering if there's anybody else that would like a nominate that would like to put their name into so we can vote on that.
Just for chair.
Mhm.
No, not me.
Okay, well, good. I would like to call for a vote. All in favor of nominating Shannon as the chair of the Board of Health, please say aye.
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 Do a golf clap now?
Any opposed? Hearing none, thank you so much for taking on that role, Shannon. Yeah. Yeah. Is there something you?
Oh, I was just gonna slow you down.
Rules.
I was just gonna slow you down. You made a motion, so ask for a second,
Oh,
ask for public comment.
okay. Mhm. I should
So
know
there's-
that by now,
Yeah,
but
that's
I'm
okay.
retiring,
Yeah,
so.
I just.
Don't care.
Okay, well, so we'll do it right for the vice chair, but we don't have any nominations that I'm aware of for vice chair. So I'd like to know if there's anybody on the Board of Health that would like to volunteer themselves or nominate anybody as vice chair.
It might help to know that Shannon will never be absent from a meeting and
Yeah.
you don't get to be sick,
Yeah.
go on vacation.
Okay, hearing that we're not quite ready for that, we do have Board of Health member elections or appointments coming up at the next commission meeting, which is on the 1st at 9 a.m. And I encourage any Board of Health members to attend and observe and listen to that process. It's been an active time, I think. We've got how many, 4 or 5 folks
Yeah.
that put their name in?
I
Is
would
that right?
say closer to 7.
Oh,
total. Like
great.
off the
Last
top
time
of
I
my
checked.
head, yeah. Off
Okay.
the top of my head, there's a good 7 applications. Commissioner Rolfe, do you remember off the top of your head how many applications came in for Board of Health?
I think I saw one for the doctor position
Mhm.
and maybe 6 for
Yeah,
the board position.
yeah, yep.
Can I ask a question?
Please.
Is it okay for us to wait until new people come on to go for vice chair?
I think that's what we should do.
Okay, yeah, for me,
Yeah.
it sounds like the right move. And just to remind us, is there any special criteria or obligations of a vice chair that would be useful to know?
I don't think so, other than being okay with learning the rules of Robert's rules or messing up over time. That's probably just about it. Usually what would happen is the chair is in the role of leading, and if the chair can't be there, then ahead of time, they'll reach out and say, hey, are you available to facilitate the meeting? And that usually seemed to work pretty well, so.
The biggest responsibility is really stepping in when the chair is not available, so.
Okay, so it sounds like our plan is to wait until after the appointments have been made, and then this body can readdress that question. And so the next position that we have to appoint is the hearings officer. And Miss Lisa, I'm hoping that you will be willing to allow me to nominate you to continue in that position.
Or that's fine.
Thank you, Lisa. We appreciate you.
I second that motion.
Thank you so much. Is there any discussion? Any public comment? Any further discussion from the board?
I was gonna say no public comment.
Okay, great. Okay, so then we can call for a vote. So all in favor of electing Lisa Kaufman, appointing her back into her position for the next term as the hearings officer, please say aye.
Aye.
Any opposed? Okay, hearing none. Thank you so much, Lisa, for staying in that role for us.
Yep, thank you.
And then the next role is the Water Quality Protection District Representative, which I've been serving on that board for the last year or so. And so with me not being in that position anymore that I'm in, that also becomes available. Would you maybe want to just give a little synopsis of?
Yeah, we
The
need to
work
know
of
what
that.
that means.
Mhm.
What do you have to know?
So the Water Quality Protection District has its own board by state statute. The district is a part of the overall health department operations, but they are guided and directed by their board. And so they serve a very similar purpose to what the Board of Health does as far as strategic direction of the work of the Water Quality Protection District Board, and looking over their budget and really supporting the staff and the work that's happening. So the district's mission really is water quality, water quantity, and really looking at issues within the district boundaries, which is not the whole county, but within those district boundaries, they are monitoring water in a variety of ways. They monitor the flow of our surface water. They take samples and look at the contaminants that are in the water. So that's some of the work that the staff are doing. The board then is providing the guidance and the direction for their strategic plan, making sure that they're spending, they have dedicated funding. So their board looks at their finances, similar to the way that the board does it. But the Board of Health is looking at all things public health, whereas the district is really just focused on the district's work. So, but it's.
And
you've served-
the other thing I was thinking was the district is just basically the bottom of the southern part of the county up to the.
Yeah,
you know,
North Hills.
North Hills.
Yeah,
area.
it's like the tree line of the North Hills is
Yeah.
about the boundary that direction.
Does it take in
Short
part of
broken bench.
all of Bird's Eye or?
It goes almost all the way to the McDonald Pass on the west side, almost to the Spokane Bench on the east side, and then the county border on
Yeah.
the south side.
Yeah.
So that's the district boundary. And so all of their work is happening within that boundary. There are 3 staff, and the water quality meetings are once a month. They are on the 4th Tuesday of the month, and they've adjusted their times. So they start at 4 o'clock and they're done by about 5:30. So it's late afternoon is when they have their meetings.
And there's Zoom options too.
There are, yep. So they do a hybrid, so you can zoom in if that's working.
How many board members do they have?
They have less than the Board of Health, I believe. So I would say they're at 7. I'm trying to remember.
So 3 staff
sounds
and
right.
7 board.
Yeah,
board members?
yeah, 7, 8, 9. It's less, I'm pretty sure it's less than 9 because the Board of Health is 9 board members.
Mm.
Yeah, it's interesting work. Yep.
I think it's really important too, just as like Helena is growing and there's, you know, the conversation about smart development and also to just to be really, I think, literate in like where the water flows when it rains. you know?
Yeah, no,
And
yeah,
where does that water need to,
Mhm.
you know, be, and making sure that the development conversation and the water protection conversation, there's some sort of like mutual understanding and bridges. Like I see that as a really important role moving forward, as, you know, everybody knows that Helena is growing, but we have to think about the fact that our valley was ag land and like the water needs to go somewhere. And so I think that is a really interesting part of that work, is to really hear about how smart that, you know, group of people have been about using the ditches and moving all the water through and all the water rights. And it's been fascinating. And so I think it's really important, especially as Helena develops, to really understand their work.
There's been quite a bit of work around water conservation.
Mhm.
So those are some conversations that that board has.
Mhm. And then helping them get out the work, because I don't think a lot of people really understand all of the resources that they offer our
Mhm.
community. And so helping think about, I'm a networker, so I always thought about, I don't think everybody realizes that there's these offerings, I guess, for the
The
community.
water well testing.
Yes, and
is
the water
one.
watchers
Yeah.
events, and there's a
Yeah.
bunch of neat stuff they do. so.
A lot of education.
Sometimes the summer meetings are field trips.
Yeah, yeah,
Yeah, that way, which I
I loved it.
found real interesting.
Uh-huh. Uh-huh.
So I'm-
Everything up to Remini or
Yeah.
going, learning,
Grizzly Gulch.
taking
Oh, yeah.
a tour of the water treatment plant.
How the fires affect the water.
All of it.
Watershed.
Yeah.
So I'm interested, but I know, I don't know a whole lot.
Yeah.
Like, it would be a learning, and is that
I
okay?
think so. I didn't either.
Oh,
Uh-huh. I
yeah, it's very fascinating to me.
And if you'd like to learn a little bit more, and then we can table it for next meeting. I'll put you in contact with Jennifer McBroom, who is the water quality district supervisor. And then their website, their pages on the website are robust with a lot of great
Okay,
information.
That'd be
So
good.
you can,
Yeah, give
look
me
at that a
time.
little bit.
Yeah,
and-
that'd be good.
Okay. Yeah, just
But
table
I am
it.
interested.
good.
Yeah.
Okay.
I think the next meeting is July. Do we need to send somebody? Like, is it okay if nobody attends from the Board of Health?
Yes.
Okay.
Yeah, I am there, and so I can help make the connection between the two and let them know that we're just gonna be delayed in appointing a representative.
Perfect.
We went several months, a couple years ago, having a hard time finding a board member that was able to, because I think that there was their initial, or their meetings earlier were later in the evening. They didn't start till 5 and they went later into
Tough.
the evening. It was really tough for some board members to commit to that. And so when they changed their time, I think that made it easier. But yeah, we went several months without a representative. So
Typically, we try to have a different commissioner on the two boards, but this year I'm on both of them because when we got done splitting out things, Andy had two appointments at the same time, and he said, he came to me and asked me if I'd take
Yeah.
that one on as well,
Yeah.
because had two things going on.
Yeah. Yeah.
He had
So
to
Commissioner Rolfe does sit on the Water Quality Protection District Board as a commissioner, so there's that overlap as well. So I think for a month, we're definitely okay.
And if there is a gap and no one is interested, I feel like I get to learn about water already, so I don't want to take that from someone else who's interested, but if we are stuck. My schedule's a little complicated, but if we are without anyone who has interest, I will
Okay,
see
great.
if I can make that work, but happy to not take it for someone else who's interested.
I'm so glad there's interest. The water is such a vital part of our health and wellness.
Mhm.
So wonderful. Thank you.
I'll put you in contact with Jennifer.
Okay.
Yeah, thank you. Okay.
Brenda, I will also just note for the board and anyone who's interested, Water Quality Protection District will not have their standard meeting in July. On July 22nd, they will be touring their Grizzly Gulch reclamation project. So that might also be a fun activity to go visit that and kind of learn firsthand and see if it is something that interests anybody.
Mhm. Yeah, that would be interesting, very
Mhm.
interesting.
No business, just a tour.
Yeah. I'm all about that.
Yeah,
Mhm.
great.
Mhm. Okay, great, thank you. So we can move into our chronic disease prevention programs update now.
Excellent. And we have the team here, so Julie, did you want to start off?
I'll kick it
And
off.
all right. And do you have, are there PowerPoint
Yes, Sandy
slides
has
or, all right, Sandy's on it. Very good.
Thank you so
Thank you,
much, Sandy.
Sandy.
So Madam Chair, members of the board, my name is Julie Burr. I'm the perfect Sandy. I am the prevention team program supervisor. Go to the next slide, please. Oh, I can see it when I put it together. I can't see it now from here. Chronic disease remains a key priority on our 2025 community health improvement plan. And I know you've heard about it already, along with behavioral health and housing. And I have staff here today to talk about their chronic disease work. So starting us off will be Melissa Baker. Sorry.
Madam Chair and members of the board. As Julie said, I'm Melissa Baker and I am the cancer screening program. Thank you, Karen. Cancer screening program coordinator, and I've been in that role for going on 18 years. My program, like I said, provides, we provide free breast and or cervical cancer screening and diagnostic tests when they're needed to women who are uninsured or underinsured and who meet our income guidelines. So the program is aimed at women who are on the like lower end of the socioeconomic spectrum within the around the 250% of poverty level or below. We also assist with women who are diagnosed with breast or cervical cancer when they go through our program. If they actually get a diagnosis, then I assist them in getting onto Medicaid. There's a special Medicaid program that is just for women who are diagnosed through our program. And then other work that I do is we also use funds from United Way fundraising. We are a United Way agency. We use those funds to provide free screening and diagnostic exams for women who don't meet the age requirements to be covered with the state funding. Next slide, please.
What are those age requirements?
Great question. So for PAPS, we serve women who are age 21 to 64. The reason we cut off at age 64 is because at age 65, people typically get Medicare. However, there are women who can't afford or choose not to get the Medicare Part B, which is what helps with medical costs. So in that case, women 65 and older can continue to receive assistance through our program. For breast cancer screening, we typically start at age 40 and go to 64. Again, though, if a woman happens to be having some issues, either the state, either the state program can approve her, or if not, we again can use those United Way funds to pay for that. So I am also part of the statewide Montana Cancer Coalition. I have been the co-chair of the early detection implementation team for 6 or 7 years now. And I'm also part of the Montana Colorectal Cancer Roundtable. I have a co-chair who assists me with that. She and I convene that roundtable every 3 months. And yeah, that one obviously just specifically focuses on like outreach and education around colorectal cancer. So that's not something obviously that we're funded to provide screenings for, but it's still very important, obviously, to provide that education. Excuse me, the early detection implementation goal is to detect cancer at its earliest stages. And our objective is to increase screening using the nationally recognized guidelines for breast, cervical, lung, and colorectal cancers. And our strategies primarily are to promote screening through culturally appropriate education, health equity approaches using one-on-one education, small media, and working directly with our target populations. And another part of what I'm doing as a co-chair or a member of the Montana Cancer Coalition, is assisting in planning our next statewide Montana Cancer Coalition, which will be held here in Helena this year, in early October. Last year we did one screening event, and that was to partner with the Tough Enough to Wear Pink program, which is a nonprofit agency out of Missoula that provides free mammograms as well to people who do not meet the requirements. Sorry, I'm talking with my hands. People who do not meet the requirements of the breast and cervical program, so they can have like higher income or fall outside the age guidelines. And so it's a partnership with them, St. Peter's Health and Benefits Helena Imaging, to offer the free mammograms. So anybody who's interested, so Tough Enough to Wear Pink takes the initiative and they do all the advertising. So that means that there's no cost to us, which is great. And then any woman who hears about it and is interested in getting the free mammogram calls me, and I screen and see if they're eligible for our program. If they are, then I enroll them into the breast and cervical cancer screening program. If they aren't, then a lot of them do have insurance. So they just use their insurance like they normally would, but I help them to get scheduled. A lot of this is about education. A lot of women don't realize that their insurance will cover their mammograms, or they're not sure how to get scheduled. They don't necessarily realize that they might need a doctor's referral. They need a doctor who can get the results and follow up with them if there's any abnormalities. So it's also kind of an educational event. And then, like I said, partnership with Benefits and them. So the women who qualify for the cancer screening program were enrolled into the program. And then basically I just kind of already went over all that. Either their insurance covers it, or they get enrolled in our program, or Tough Enough to Wear Pink covers those very few who fall outside those guidelines. And then we're planning to do it again this October. That is it for my section. I don't know if there's any questions, or should we take questions after Karen presents? All right, thank you.
I'm sorry, the moment you step away, I have a question. How many people participated last October? Roughly.
That is a good question off the top of my head. I fielded over 60 calls, but then a lot of what happens is because we require them to complete an application, a lot of them don't follow through with completing the application. Plus, there's only so many slots available at the two sites. So it's right, it was between 20 and 25. I think it was about 22.
Still great.
Yeah,
Thank you.
yeah, thank you.
Hi, thanks so much for having me. My name is Karen McLean, and I'm with the Tobacco Prevention and Cessation Program. I'm a health coach. And I've been in this role for about 2.5 years. And so I was just sitting here thinking about how kind of my thinking has changed as I've been in the role longer. And I'm excited to kind of share you some of the pivots that I've decided to take with the program. So tobacco prevention and cessation, we have some really clear goals. The first is we want to prevent tobacco use among young people. That's really our #1 goal. We're also really tasked with eliminating exposure to secondhand smoke. We promote quitting among adults and youth. Montana is really strong in our quit lines. We have quit lines, we have a general quit line, and then we also have a quit line geared towards people under 18. It's available in other states, but one thing that's really special about our program is it's confidential, and that when talking to youth, we know that's a big barrier for maybe not wanting to call the youth quit line, is because they don't want their parents to find out. So that's something I'm really proud of with that aspect of the program. And the other thing we do is build community support and capacity for tobacco use prevention. And that looks a number of different ways, which I'll talk about. Next slide, please, Sandy. So what does this mean? Like, what does my day-to-day work look like? So we do a whole lot of community outreach. That's really, really important. I think that's one of the things further on in my job that I really come to see the value of. I think in the beginning, I found it very deflating, to be at an event for 4 hours and talk to 2 people. That's still not great. I like to reach a lot more people, but I'll tell you, there is value in showing up at community events after community events and having the same blue tablecloth and having those same conversations. I believe that really now. So that outreach is really critical, even if that day doesn't feel like you've moved mountains. Another big part of my job is investigating Clean Indoor Air Act violations. And my position is for Lewis and Clark County and Broadwater County. So that can look a whole host of ways, but the main one is we'll get a notice through something called CARS that there has been a report of violation. And so what I do then is evaluate, does it meet the criteria as a violation of the Clean Indoor Air Act? And then our practice here at LCPH, which I love, is that we do site visits regardless of whether it meets the standard or not. So I think that's really important because a lot of what we do is building relationships with the community. And I really want them to see us kind of as an ambassador and someone that can help them get the tools that they need. So we, regardless of whether it's a true violation or not, we will go do outreach to businesses and meet with them. I always provide a copy of the Clean Indoor Air Act. I provide my business card just in case if they want to follow up. And I also provide signage. And I also let them know like what the violation that was reported was. So, and I would say I've had one kind of heroic experience, but other than that, business owners are really quite receptive. They want to be in compliance and they want to be good community members. So I find that actually very kind of affirming to go out and talk to business owners. So another big aspect of what we do is engaging with youth. That's really, really important. That goes back kind of to the outreach. So that means we show up at different events like Back to School Bash. We show up to health fairs. One thing I want to do this fall is to actually be at teacher conferences. And so I can kind of connect with parents of youth, right where I know they'll be waiting and have time to talk to me. Additionally, engaging with schools is really important. This is one thing that I've learned that I need to take kind of a different approach to than when I started. So kind of when I started, I would send lots of emails and make lots of phone calls and say, hey, Principal Smith, I really want to talk to you. And it would be very rare that I get a call back. And I think in retrospect, part of it is, I mean, one, I know is they're very busy, but also I didn't really have an ask, right? I didn't really have an action item. So what I decided to do was how could I get into the schools on a regular basis so I could have these conversations with school staff. And what I came up with was a vape recycling program. So I go to every middle school and every high school in Lewis and Clark County once a month, and I collect any confiscated vapes. So vapes are not allowed on campus. And so they are confiscated and they're actually a pretty big fire hazard. So like keeping your wooden desk, right? That's problematic. So the reason I came up with this is I want folks to see public health as providing a service. I want them to remember that we're here, we provide a service. And then also I've had such amazing conversations with principals and front office staff that I never would have had otherwise. So I'm providing a service, I'm being visible, I'm showing up consistently, and then I'm really making relationships that I wouldn't have been able to make otherwise. So that's been really fun. And when we have our mobile clinic van, I drive that around. And so I feel like it's like a big billboard, right, of the work we do. And I should say that the city county transfer station has been very generous in accepting those vapes to be recycled, even though that's not kind of something they do. Like if you look at the list of services they provide, that's not on the list, but they very generously have taken those to be recycled. So I appreciate that. So building community, again, that looks all different ways, but I think it's showing up and sharing your successes and sharing your challenges. Supporting local businesses, that happens both around Clean Indoor Air Act complaint violation visits, but also just in general. I have businesses call me asking for signage, asking for clarification on what the Clean Indoor Air Act says. So I'm always excited again when people think like, oh, I have a question, who could we call? And they're like, oh, let's call public health. I aspire to be that person. Another thing that's more recent is I was invited to be a part of an implementation committee for SB 390. In this past session, the Clean Indoor Air Act was expanded in order to include e-cigarettes. And that's a really, really big deal. It's a huge win. It's really exciting. And they wanted people in my role from around the state to help come up with ways that we can help businesses and other community members implement it. What would that look like? And I think one reason they invited me was because in Lewis and Clark County, we already have e-cigarettes as part of our Clean Indoor Air Act. Okay, next slide. Oh, I guess I breezed through that. Any questions about the tobacco program before I move on? Yeah. please.
So the act itself.
Yes.
So what would a violation look like besides cigarette smoke?
So in Lewis and Clark County, our act is written about infiltration into a business. So if you were, let's say you were having dinner and there was someone smoking outside of the business and the smoke came in and you could smell it while you were inside the restaurant, that would be a violation. Trying to think what else would be.
Infiltration is the big.
Infiltration is a big thing, and interestingly, in our county, we don't have a feet, like some other counties have, like, if you're gonna smoke outside the restaurant, you must be 30 feet or 25 feet away. Ours actually, I think, is much more robust, and that we don't have a feet. We don't, it just says any infiltration. You could be a mile away. If there's infiltration, it's a violation of the Clean Indoor Air Act.
Interesting.
Yeah.
I was just gonna say, I stumbled upon your vape recycling program
Yeah.
inadvertently as a middle school parent and had
Oh,
a moment
yes.
of like absolute horror. I was like, wait, what?
Yes.
We're recycling things? And then I was like, that is genius. And it was an accidental conversation and you have done a stellar job building those
Oh.
relationships. And the discussion about bags of vapes in middle school, that was a setback for me, but it's really impressive what you've done.
Oh,
And I
thank
think
you.
like hearing you explain it and having seen it before that explanation, it really is, I think, a very clever way to have difficult conversations.
Oh, well, thank
And I
you.
think that the amount of vaping in the middle school, again, setback, stunning, still not over it, but I really applaud what you're
Oh,
trying to do
well,
there.
that's
So
very
thank
nice to
you.
hear. Thank you. Yeah.
And
yes.
yes, back at the city for the partnership,
Yeah.
because we wouldn't have known what to do with them once we
No.
collected them if we didn't have a good partnership with the transfer station who was willing to take them.
Yes.
So that's kudos to the city for that partnership too. So.
Yeah, when we first started it, they said, well, you need to disassemble them before we can recycle them. You know, I'm a scrappy gal. I know how to get things done. But there I was, like in our mobile clinic van with 100 vapes. And I'm like, I don't know if it makes a ton of sense to use staff times, like, disassemble 100 vapes. And they're like, you know what, we'll take them anyway. So they've been really above and beyond generous. One thing I'll say just to your comment is that I have made an intentional effort to not do a student facing vape recycling, because I don't want to normalize, like, everyone vapes, and when you vape, you should recycle your vapes with me, right? So I make sure that it's like in tandem with the administration. Yes. Yeah, so when I do these visits, I hear a lot from principals, and I would say that the biggest problem is in the middle school. And one reason I think that it's kind of a bigger problem than in a high school is because high schoolers have cars they can go to vape. Middle schoolers don't. So, but I think if we're consistent, that's what I have to believe. Yes.
How are they getting them?
So we hear all different things. We hear that, maybe one kid has one and then they share them. And I guess a big practice is to, instead of keeping it on your person, because the school resource officer can do searches, they like put them in a certain trash can in the lunchroom, underneath the liner, and then they share them. We've also heard stories of parents buying them for their children in the misguided thought that, well, it's better than cigarettes. And we know that there are some vendors in town that will sell to children, unfortunately.
There's no law about it.
There is.
Oh, well.
Yes, yeah, there is. I mean,
The enforcement of it is tricky. We don't have a compliance program at the local level. The state runs the, what do they call it when they go? I always used to call it their sting operation.
I mean,
but there's a better word for it.
yeah,
Where in a secret shop.
yeah.
A state staff will go in and see if the vendor is complying with the law
Yeah.
and if they are selling to minors. and they will hold them accountable. But we don't have the capacity nor the program at the local level to do that. And the state really doesn't either. So I don't think it gets done at a consistent level. It's really compliant based. It's a complaint based program
Yeah,
across the board. Like, we are not out there proactively looking for violations. We wait for a complaint to come in.
Sure.
The state's the same way with violations of selling to minors, is they wait for a complaint to come in
Yeah.
before they're out trying to hold.
Makes sense.
yeah, I mean, in some ways that's frustrating, but I also think that that's better for, if we're trying to build a relationship with the community. I like being someone who responds to a community member instead of like someone who's out, you know,
Fine.
patrolling. Yeah, right, like that does not feel like a good use of our time. Did I answer your question? Okay,
Thank you.
yeah, yes. Commissioner Roberts?
As a kid, probably starting at about 10 years old, I had to clean the ashtrays in my father's business.
Wow,
And once a week, I had to go around and collect all the ashtrays and clean them. And he was insistent they be perfectly clean. You had to get down there with your fingernails and clean the nicotine out.
oh,
And I swear that's why I never smoked. So I made my mind up that I was gonna have my kids clean ashtrays if I had to go buy them somewhere.
yeah.
And by the time my kids were of the age, there were no more ashtrays in businesses, so. Is there anything else, any other way to make the kids repulsed by it?
I mean, I think just getting the message out about the impacts, I think kind of the biggest headway I've made in talking with young people is appeal to their vanity.
Yeah.
Just kind of like what it does to your skin and your teeth. And I think that it's just human nature. Like, if the consequence feels like it's 20 years down the line, I think it's really easy for all of us to just say like, oh, I'll deal with that in 20 years. Or we hear from lots of students, well, I'm just gonna vape for the summer and then I'm gonna stop vaping.
Yeah.
Right, so this is just a short-term thing, but I mean, it's literally designed to make it so you can't quit, right? So,
A couple of evidence-based
Mhm.
strategies when it comes to youth in particular. Adults are a whole different story.
yeah,
You use a different approach with adults, but for youth in particular, there are two strategies that are really highly effective. One is peer-to-peer messaging. So for the seniors at the high school to talk to the middle schoolers about not vaping is very powerful. So they hear that message from a peer where they don't hear it from an adult that's saying it. And then the other strategy that's highly effective is the science of the positive. So really focusing on the fact that more kids are not using and using the data, that we have data very clearly says that there are more kids that do not use than that are using. And so you focus on, it's a peer pressure tactic of kids want to be a part of what is popular. And if you focus on what's popular, which essentially is not using, because more kids aren't doing it, then those are a couple of strategies that actually work and have evidence that work. So,
yeah. And I'm really hopeful that adding the e-cigarettes into the Clean Indoor Air Act will make it less socially acceptable, which will then, I'm hoping, have kind of a trickle down effect. The less you see people vaping, I would think, I mean, I don't have the data to back this up, but I would think that it would make it less on the forefront.
and educating parents so that they're
Yes.
not purchasing and giving
I
them.
just can't get over it. So what's the difference between the vaping and e-cigarettes?
The same thing, yeah.
They are basically
Yeah.
the same thing.
I've heard it, like the e-cigarette is the actual device, vaping is the active.
Active, the verb, yeah.
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 Is it true it gives cauliflower lung?
Popcorn is what
Or
I
popcorn.
heard.
Yeah.
Where, yes, so the chemicals in the device, when inhaled, is causing significant damage to especially young lungs that aren't fully developed. And so there's a lot of research about the health impacts of vaping, and I've heard it called popcorn lung, but I don't know what the actual medical terminology is for that. But it is causing significant damage to young lungs. Yeah. Kids that are using daily, the health impacts are pretty significant.
So are they getting a hit of nicotine or what is it? So they feel good.
Yeah, nicotine and marijuana. So you can get vape devices that distribute both nicotine and so there are kids that are smart enough to convince their parents that it's just water vapor
Mm.
and there is.
Especially zero water.
Yeah,
there.
yeah. So, they've convinced their parents that it's a safe alternative to smoking. There's no nicotine, there's no it's just water vapor. And parents are buying that. So we
Right.
have a lot of work to do with helping parents understand as well.
So I caught my son, he's 42, baby. And I said, I said something about the popcorn line or whatever.
Yeah.
And he goes, oh, that's just the stuff from China. You don't have to worry about that.
So here-
I don't, this is the good stuff.
So here's the thing, there's only 34 approved vapes. And if you go into the drugstore, to the gas station, you'll obviously see far more, but there's just not resources to go in and take those ones that are not.
So there are
approved.
some that are not,
Many, the majority of
that are
them.
terrible.
They're terrible. We don't know if it says what's, on the label. We don't have a way of verifying that. They're from overseas.
Uh-huh, so that's true. So, I mean, that was the excuse he was
Yeah,
using.
yeah.
Yeah.
I still think that the best thing we can do is burn a bunch of cigarettes in an ashtray, get them really there and then hand them out and make kids clean them.
When I used to do home visiting nursing, one of the strategies with trying to get them to quit smoking was to, every time you smoke a cigarette, put it in a mason jar with water, and every time before you take a smoke, breathe
Yeah.
and see if you could, and I was like, oh gosh, being pregnant like that, I was like, oh. Yeah, that was a strategy that I never.
I can honestly say I've never had a cigarette in my mouth. And it's because of those doggone ashtrays, I know.
Gotcha.
Years later, I thanked my dad. He didn't understand what I was talking about, but boy, it made a difference for me.
It just gets you.
Yeah.
They're so addictive, those vapes.
Yeah, I mean, they're
so
designed for that. That's,
Yeah,
I mean,
and I think the sugar too, I think there's a sweet, there's a sugar.
a lot of.
yeah, so that's one tactic that other states have taken is have a flavor ban, because we know that's a big predictor in whether youth take up vaping is the flavors. If it just tasted like a gross ashtray, I think it'd be less popular.
So is it true that kids that have ADHD, it has the opposite effect on them, like the nicotine, it doesn't ramp them up, it actually calms them down?
I'm not sure.
Cause I think that's one thing that there's a lot of kids with ADHD. My son was the one that I caught. He's 42.
Yeah,
Yeah, and I think he doesn't want to take Ritalin and that kind of stuff, but he vapes.
Oh.
And
Yeah.
it's been completely different. Honestly, I can say his personality's changed for the better.
yeah.
since he's been
Well, let's
doing
not promote that.
I know, right? I shouldn't have said that in public.
Is there any movement towards flavor ban? Have we seen any signs of legislation?
Not in Montana.
No,
Yeah.
I remember an attempt at a flavor ban multiple sessions ago, but it went nowhere and I haven't seen an effort since. So.
I will note that when I have these inadvertent conversations about vapes, I asked something about a flavor and they were rifling through a pillowcase full of cartridges, reading off the
Right.
flavor names. And I was like,
And the names are like gummy bear,
Yeah.
cotton candy,
Yeah.
but that when you talk to the companies, they're like, oh, those are for adults.
yeah,
And it's
no,
like,
really, it was a very eye-opening conversation. So
right.
I applaud you
Yes.
for what you're trying.
I have
to
one
do.
question.
Yeah,
Is
sure.
there a lot of evidence yet about the secondhand effects of vaped exhalation on secondhand smoke? Do we have that data yet?
I'm not sure about the secondhand smoke, but
Uh-huh.
we're getting more and more data
Okay.
about.
I mean, we know that it's not
Yeah.
healthy to do it, but to be around it, it seems like, socially, people think that they're fine to do that around other people. And I've always wondered, I wonder if I'm getting hit with something.
Yeah.
Yeah, that was one of the biggest pushes that allowed us to get to the point where we are with tobacco regulation in public spaces was the
Mhm.
secondhand smoke. So
Mhm.
I anticipate that we'll be seeing
More data to
something
come at some
Yeah.
point.
Yeah.
Yeah.
And
Yeah.
a question, the data is really out, right? Because isn't it kind of like a guinea pig generation? Did people anticipate us having more data and more consequences seeing that 20 years down the road?
I mean, that's my understanding, yeah.
Long-term health effects.
Yeah.
and-
Like we don't really fully understand
No.
now, but we will then.
Yeah, I mean,
So
it's,
at this point, people are just making those educated guesses.
I think there's some data. There's,
Yeah.
yeah, like the popcorn lung, that's
Sure.
real data, that,
Yeah.
like, the medical community is seeing some significant health impacts, but what that's gonna look like 20 years from now, we don't know.
Yeah.
Mhm.
Great presentation.
Oh, thank you. Should I?
Oh, keep
Okay.
going. Yeah, we have lots of questions for you.
Yeah, thank you. I just wanted to touch on Healthy Communities Coalition. That's also part of my work. So that's a coalition of providers, public health folks, public health adjacent organizations. We meet quarterly and we do all different types of work, including we help with it's escaping my mind. I know, I was thinking of the big report, the
community health insurance.
yeah, Community Health Improvement Plan, the CHIP. Yeah, so we are not by ourselves, just one little part of that. So that has been really rewarding. And then underneath Healthy Communities Coalition is something called Aging Well, which is a work group that meets monthly. And that I've really, really enjoyed working with folks. It's just so cool to see, librarians and providers and all of them meet together to talk about how we can build a really more inclusive community in terms of making it friendly across the age span. So thank you so much for your time and attention. I appreciate it.
Thank you.
Thanks for your work.
Very good.
Thank you.
Okay, we got everybody? Perfect, thank you. Okay, so up next is the 21C survey results and next steps.
Right, so Madam Chair, members of the board, in your packet, there is a report that I included, and you'll have to remind telling me what page that is on that. Starts on page 9 of your packet. And I'll just walk you through a little bit of background, what the assessment said and what the next steps will be from this assessment. And so background is that the Public Health Accreditation Board, so the board that accredits health departments at the state and local level across the nation, they started a 21st Century Learning Collaborative. And Sandy, if you don't mind pulling up that website, I want to show you the map of the states that are participating in the 21st Century Learning Collaborative. So the Public Health Accreditation Board has selected essentially 21 states across the country. And if you, Sandy, just scroll down a little bit to that map, these are the states that are participating. And this has been going on for several years now. And Montana is a part of this collaborative. And what Montana's been doing is learning a couple of things. One is what systems transformation is looking like in some of the other states across the country that have been doing this work for much longer. Montana is newer to the collaborative, whereas Oregon, for example, has been participating a little bit longer and actually doing systems transformation work around public health for years. I would say a decade or more. And so learning from what other states are doing to be innovative and to make sure that public health is being delivered in essentially an excellent fashion, which is really what accreditation it does and what is for us. When we meet those standards and measures of accreditation, we can claim to be an excellent health department, essentially. And what FAB is doing is bringing these states together to learn together and how to really take public health to the next level. And so the assessment that we participated in last summer, trying to remember what month that was, it was sometime last summer. The assessment was essentially spurred by the work that's happening at the national level. And the assessment looks at how we are doing, the whole public health system across the state of Montana, how we're doing with implementing the foundational public health services. And so, Sandy, back one page, there's just a reminder for, forward, there we go. So these are our foundational public health services. They're on page 12 of your packet. the foundational public health services are what you should see in a public health department, no matter where you are in the nation. So whether you're in Connecticut, in New Mexico, or in Montana, or whether you're in Libby, Montana, Eureka, Montana, or Helena, Montana, you should have access to these public health services. So communicable disease, chronic disease and injury prevention, environmental health, maternal child health, and access and linkage to clinical care. Those are the foundational areas that all public health departments should be delivering in our communities. And then with that, all public health departments should be delivering the foundational areas using those capabilities. So back one page, Sandy, just real quick. Those foundational capabilities include assessment and surveillance, community partnership and development, equity, organizational competencies, policy development, accountability and performance management, emergency preparedness and response, and communications. So again, no matter where you are in the country or where you are in the state of Montana, the health department should have these delivering services within these areas and are capable in these foundational areas as well. And so this assessment that we did assessed how we as Lewis and Clark Public Health are doing in these areas and in these capabilities. Okay, now you can go to the next page. Thanks, Sandy. And so we completed this survey as the state of Montana led the charge as a part of their participation in the 21st Century Learning Collaborative. And the reason why it is the three areas that are listed in your packet on page 13 and up on the screen as well. So the state of Montana really wanted to understand what it looked like. So we were not sure from one end of the state to the other end of the state what services were being provided and what capabilities each of the health departments had. And so this assessment essentially helped determine and understand what that looked like across the state. Every single health department participated 100%. The way they did it helped. The staff that collected the data traveled to every health department in the state of Montana and collected the information face to face. So we have a very, very clear indication of what this looks like across the state of Montana. We're going to be utilizing this data to understand where our greatest strengths are, and then where we need to bolster or improve in the areas by collaborating across the state. So it was made very clear when they collected the data and then when they gave us our results that the intention of this was not to say, hey, Lewis and Clark Public Health, you are really great in these areas and you really are terrible in these other areas. Good luck with that. Here's your results, figure out how to make yourself better. How the intention really is a system across the state to understand where the strengths are and where we need to do some improvements and work together collaboratively to elevate all public health across the entire state of Montana. And so really leaning into each other's talents, understanding where the strengths are, understanding where the funding is and where it isn't, and then utilizing all of that information to make public health better for the whole state of Montana. So that's the reason why the assessment was done. And what I wanted to share with you today are essentially, I just wanted to briefly go over the areas of strengths that were identified in our assessment, and then some areas of opportunity for growth as well. So on pages 6, go ahead. Sorry, I should have, I just can't see it up there. Yeah, it's page 17 and 18 in your packets. These are the areas of strength that were identified in our assessment. I actually think that you all received did you all receive the state report? The Department of Public Health and Human Services indicated that all board members were going to receive the statewide report. Okay. I thought that they had sent that out, but I just want to make clear that this report is out. These are our results. So this is Lewis and Clark Public Health. But what you can see in those graphs is that we are compared to other jurisdictions of a similar size. So essentially that's 7 health departments in the state of Montana. It's Cascade City County Health Department, Missoula City County Health Department, Gallatin County, Yellowstone County, Butte, Silverbow, and Lewis and Clark. So those are the 7 large health departments in the state. And then the graph also compares to the whole state of Montana. And so what you can see in the areas of strength on those 2 pages is that we are doing really well. We're showing excellence in a lot of areas, and we're leading the way. What you see is that we're doing better than similar sized jurisdictions across the state and the state of Montana in 9 of the categories, which is that's excellent work. And I give kudos to the staff at the health department for the work that is happening. I'll pause there. Do you have questions about the areas of strength? It's pretty straightforward. I can answer questions about what those categories mean or give an example of what those categories mean if you have a question.
Yeah, I would love to hear that. Like, obviously, like maternal and child health. So are you digging into like what services are provided at that granular of a level?
Yes, so there were a handful of questions for each of those categorical areas. And essentially what they're asking is, do you have services in place? Are you participating in community-wide coalition work? I'm trying to remember what some of the other questions were, but what you see is that we were able to answer at level 4, which is the highest level for all of the questions within that category. And so we essentially are doing all of the things within maternal child health that are expected of health departments. Cool. Yeah.
Did it drill into like what programs do you offer, or is it more
No.
just do you offer?
Yeah,
Okay,
yeah.
gotcha.
Are you offering services? Are you partnering with community members that are offering services? Things like that.
Just out of curiosity, is it possible to see what some of the questions were? Is that public information?
Yeah, actually it is. And
I scanned the packets. Forgive me if I missed
I
that.
remember all of the questions are at the back.
Okay.
So maternal child health is on page 33, and some of the questions are: implement a maternal child health plan, provide or support access to programs and services, identify and implement resources for maternal child health, conduct annual fetal, infant, child, and maternal mortality reviews, programs and services for children and youth with special healthcare needs, promoting evidence-based informed interventions to support positive health outcomes, and providing information to the public about maternal child health. Yep, they're all in the back of the report if you're wanting to dig into the actual questions for each category.
Thank you.
Yeah,
Interesting.
yeah. Any other questions on the areas of strength? I was just really, of course, it's our data. So when I got the results, I should not have been surprised because we actually gave them the answers to the questions. But to see the comparison, that's what surprised me, that we are leading the way in the state of Montana, and we're leading the way among other large health departments in the work that we're doing. I did want to spend some time talking about our areas, opportunities for growth. And so this is on page 19 of your packet. And so there were 3 areas that we still scored really high. And actually, if you look at the graph, we scored higher than other jurisdictions of the same size and also the state of Montana. However, we're identifying it as opportunities for growth because we're not perfect. And so these are some areas where we can actually continue to do a little work and improve how we do our business. So elevating health across Montana, the community health assessment, and chronic disease were the three categories. And so when we are looking at that first category, elevating health across Montana, there were two areas where we have identified work that we can be doing. And actually, since we did the assessment last summer, we put out a community health assessment that would have, if we would have put out this community health assessment before the assessment, our answers would have been different. And so that's what I wanted to point out to you now is that we identified some areas of growth and we made those corrections when we put out our new community health assessment. And so the first area was providing data in a stratified format. So stratifying our data by demographics. So what that means is, are we looking at our data in a way that lets us look at females versus males, or the younger population in our county versus the older population? Are we looking at our data across the various races that live in our county? Those with disabilities, those without disabilities, different education levels, veteran status. Are we looking at what the health status is of our veterans versus the average population? Are we looking at data as it relates to those living in poverty and those that are not? Are we looking at our data for the people who live in the urban area versus those that are living in the rural area? That's what we mean by stratifying by demographic. Like, are we slicing and dicing our data in a way that allows us then to provide our services to those that we are seeing some disparities? And so I do have one example. There's several examples actually in our community health assessment where we did this better this time around in our community health assessment versus the 2021 version. So if you were to put the two reports side by side, this is one of the things that we did better. And one example of that is in our behavioral health section of the data report. It's some data that we talk about suicide. So percentage of suicide deaths by age group. We have data that's broke down for individuals that are 19 and younger. We are looking at the data for 20 to 24-year-olds, 25 to 44-year-olds, 45 to 64-year-olds, and 65 plus. So really looking at those that have died in our county and what those age differences were. That's really important for our suicide prevention work. Like, where are we putting our effort? Who do we need to reach with our services? Who do we need to reach with our messaging? Who is being impacted the most? The other example on the same page, also the same topic around suicide, is males versus females. So what the data is showing us is that death by suicide in our county, 82% are male and 18% are female. And so we knew already before this report even came out that we needed to start looking at data in our community at a more granular level than just the number of death, the death by suicide in our community, but we needed to look at it in a different way. We needed to look at the age. We needed to look at the gender. We also need to be looking at, is it rural? Is it urban? So really slicing and dicing data in a way that allows us to adapt our programming and adapt our messages to be more effective with the work that we do. The other item under elevating health across Montana is to provide the data that we have that's a different one. So providing data and information on health disparities. And so are there populations in our county that are impacted by poor health in a different way than other other members of our community. And so we have an entire section in this community health assessment. It's called Health Equity. It's a whole section too. And it does break down and helps us to really understand better what that looks like, or get a better understanding of where the health disparities are in Lewis and Clark County. And this data essentially showed us that American Indians in our community have poorer health outcomes than the white population. And so that gives us information about how we can go about doing our work to reach those that are actually having greater struggles with health than others. And so the life expectancy, for example, the page that talks about the various ways that the mortality rate in our county based on different causes of death. And that's broke down between American Indians and the white population in Lewis and Clark County specifically. So that whole section for health equity does exactly what this survey said we needed to do better at. So between our 2021 community health assessment and our 2024, we do it every 3 years, 2024 health assessment. We know that we need to do that a little better, look at our data differently, report data differently. And so we're already making improvements in this way.
Were the data for this evaluation taking into account both reports, or was it before the 2024 report?
It was before the 2024 report was done and published.
Okay.
Yeah. So what we were thinking back on how we went about the 2021 and saw some gaps.
Yeah.
And we had already identified those gaps and started making changes in the way we were putting our data out for the 2024 report.
Okay. So this isn't reflective of the most recent.
It is not,
Okay.
right? What I was trying the message I was trying to send is that we knew we knew that we had room, opportunities for growth already and started to make those changes when we put out the new report. The second area is the community health assessment, which is exactly this document right here. And the drawing data conclusions was an area that we identified that we could do better. And so in the new report, there's a whole section that summarizes the assessment, and it breaks it down by mental health and substance use, housing, chronic disease, access to healthcare. And so we did a better job of really drawing some conclusions and saying, okay, well, if this is the summary of chronic disease, then what? And then how that looked in our community, the new iteration of our community health improvement plan is kind of how we took the data conclusions and then said, we're gonna have action around it. We're gonna do something different in our community to improve the issues that we're seeing around chronic disease in our community. We have done it that way, but we are doing it better now than we've done it in the past, as far as making those summary statements, drawing those conclusions, and then acting upon those conclusions. And then providing data in a different format. So we actually have a data dashboard on our website now that we haven't had before. And thanks to Valerie, our epidemiologist, who is the whole community health assessment is not on our data dashboard. But if you all remember, we did the door-to-door survey and the face-to-face survey. Those results are on the data dashboard, and you can really interact with the data, which provides a different way of kind of seeing what data we have available, other than just flipping through a book that sits on a shelf. She is working really hard to get it put out for the public in an easier format, in a more interactive format, more accessible format. So those are a couple of things that we are doing to help address the community health assessment deficiencies that we identified in the assessment from last year. And then the last is chronic conditions or the chronic disease section. And essentially what that section says is that we need to be using best practices, and informed programs, and then influence others on changes that improve chronic disease. Well, you just heard a report from staff on some of the things that we're doing in this area. What I can say is that we are restrained by staff capacity and funding to do more around chronic disease. So we're going to do the very best that we can with the resources that we have. But I'm going to say it's going to be really hard to meet the markers on chronic conditions without an adequate staffing and without adequate funding. So those were the 3 areas of opportunity, the areas for growth that were identified in the assessment. And some of the things that we're doing and have been doing to try to address these and improve in these areas. Do you have any questions about the areas for growth, opportunity for growth? All right. And then, so Sandy, if you want to bring up the Montana 21C Public Health website, this is another step that's happening kind of at that statewide level. So these results, of course, we received them at the local level, but every county received their results, and then there's, of course, statewide results as well. And so there's an initiative. It's called Montana 21C. And the purpose of that initiative is really to build a stronger and more agile public health system by creating a shared vision and identifying resources to realize that vision. And if you want to scroll down to where it lists our endeavors. So this statewide effort is really looking to improve systems coordination. So how can we across the state support each other in a systematic way, in a coordinated way? That delivery of public health services. I'm going to give you one example of what this could look like, but please don't think that that's the only way. But one example of how we can deliver public health services across the state of Montana is that Broadwater County is our neighbor, and they have a very small health department with just a few staff. And we, their neighbor, have much more, we have greater capacity, we have more staff. We can help our neighboring counties provide public health services, and we do that. We do that already with WIC. We provide WIC services in Marr County, Broadwater County, and we provide cancer prevention work in Marr County, Jefferson County, Broadwater County. So there's some really great examples of how we can support each other kind of with our neighboring counties, especially with those smaller counties that don't have the same level of resource. And so that's one way that we can improve the delivery of public health services across the state. They're also going to be looking at workforce development. We need to be able to recruit really great people and retain really great people, and then make sure that the people that we do have working in public health are constantly learning about how to get innovative and creative in delivering public health services. And then the policy and funding, I think, is going to be probably one of the most substantial pieces of work that Montana 21C will do. And that really is looking at how do we improve the infrastructure of public health across the state of Montana through sustainable funding. So what we know right now, and I shared this last month when I was giving my budget presentation to the board, is that the state of Montana does not invest general fund dollars in public health. The state of Montana has some special revenue, like the tobacco settlement fund that comes to local public health to do our work, but there is no investment from the state of Montana in public health at the general fund level. That is one way that there can be some advocacy to help sustain the work and improve the work that's happening at the local level. I also shared that 37% of our revenue, our total revenue, is coming from federal funds. And if there is a significant change to the way the federal government is funding public health, there's going to be a pretty large gap that would need to be filled. And if our state isn't looking at filling, then we're going to be left at the local level to figure that out. Either we need to figure out how to fund it at the local level, or we have to eliminate services. And so this policy and funding work that's happening through the 21C initiative is going to be really, really important moving forward. So that's a step that will be happening at the state level. And that this assessment that I shared with you will be used. This assessment will be used to help move these endeavors forward. And then just right here in Lewis and Clark County and Lewis and Clark Public Health, some of our next steps are going to be sharing these results. So sharing them with the Board of Health is really important so that you all know what the status of your health department is. We'll be sharing it with our staff within the health department. Our community partners need to understand this as well. So really sharing these results across the board and then building in goals within a new strategic plan, which will be next year. We'll be asking the Board of Health to participate in a strategic planning session in 2026. And so building in goals that help us to do our work better based on what the assessment shows. And then also participating in the statewide work. So I've been sitting at the table as a representative from a local jurisdiction. There's a lot of people that are coming together, some of which are statewide. The Montana Public Health Institute, the Montana Department of Public Health and Human Services, Montana Public Health Training Center. There's a whole long list of partners. And Sandy, I think there you go. If you scroll clear to the bottom, here's a sense of, nope, up just a little bit. There you go. All of these logos shows you who all is participating right now in this work. And I've been sitting at the table as a representative from the local jurisdiction as a local public health official. So continuing to engage in these conversations, push this work forward, using the assessment results to really understand what's happening and how can we do better. That's essentially what you will see happen over this next several years. So that is the 21C update that I wanted to give you.
Thank you.
Which is quite a bit of a mouthful. So I'll pause there and see what questions that you have.
Carrie.
Oh, I have to say it's a lot. I mean, it's just a lot.
Yeah.
Yeah, it really boils down to funding.
It does. Yeah.
Yeah.
We can take an assessment all day long and
Exactly.
it'll tell us what we're doing well and what we're not doing well. But if we don't have an ability to improve, then that it's just it doesn't really do us much good. It's as good as the piece of paper it's written on, right?
Yeah. Exactly.
My
So-
brain is like going off about all the things that I'm wondering if it would be hard to do it without pointing fingers, but start looking at like the health improvement, like assessments
Mhm.
against all of the offerings and say, start to compare investment in public health and actually measure the value now that we have this data.
Yep.
That's exciting.
It's exactly what we'll see happen is if we want outcomes, if we want health outcomes in the state of Montana, we're going to need to
We need to
invest.
pay for them.
Yeah, we need to invest in
Yeah.
in the public health infrastructure,
Well, and you need to take that to the legislature, right?
Yeah.
To get the
which is
money.
part of the 21C
Yeah.
initiative.
Mhm.
Yeah.
But having that data, that's what people remember.
Yeah.
Is, like you just said, comparisons. How much does it help?
Mhm.
What has it done in the past? Where do we need to go for the future? No.
It's really important that you have, as board members, understand this so that when there is an effort to go before the legislature, you all are informed and can be a voice in support of public health at that level.
Mhm.
So that was my effort today, was to start informing you about some of this work and what it means for us at the local level and what it means for statewide efforts as well.
Right, very good. Did you ever hear any feedback about, like, were all of the counties pretty willing to participate? How, like?
It was
how-
100% participation.
I think that's cool.
Mhm. Yeah,
I think that means there's like, must be really good relationships from
Mhm.
local to state right now. I like hearing that.
it's incredible.
Mhm,
Yeah.
That's great.
The State Systems Improvement Office
Mhm.
is doing a really great job. And I think the biggest thing that they're doing that's having the greatest amount of impact is that they are not doing where the state will tell you what to do, but instead let us help you figure out what you want to do and we'll support you in that. So they've changed their approach from, how it's been maybe 10 years ago.
Great.
Yeah.
I'm so glad it's
Yeah.
working.
Yeah.
Good.
Didn't know
Okay.
there
well,
was such an organization. for-
Yeah.
State improvement.
Yeah,
Yeah.
Certainly it's beneficial
Yeah.
for them to be looking at themselves.
They led this assessment across the whole state. They're the ones that traveled to every single health
Oh,
department and
okay, I was
collected the data.
wondering.
Yeah.
That was a
Yeah.
question I had.
Yeah, they did a great job.
Wow.
And then put the reports together too.
Mhm. Bravo.
Yeah.
Okay.
Right.
All right, on to the next.
Okay.
PFAB.
Yeah, the Public Health Accreditation Board, we received reaccreditation last April. And it is now time for our annual report. It's actually due the 30th of this month, and rest assured it's been submitted. But I just wanted to give you a couple of highlights. Each annual report, what the Public Health Accreditation Board wants to hear is, are you continually making progress on meeting the standards and measures of public health accreditation? So I don't know if you all remember when I brought Show and Tell last year and showed the standards and measures for reaccreditation when we were celebrating that we were reaccredited. The annual report this year asked us to look at any of the standards and measures that we struggled to meet fully when they did our site visit last year. We had one out of all, I don't know, 100 and some standards and measures that we had to meet. There was one that we only met slightly. And so in our annual report, they asked us to go to say, okay, you only met this measure slightly. What are you doing to improve on that? And so the one that we only met slightly had to do with collaborating with others in the community to implement a strategy to assist the population in obtaining healthcare services. And then the follow-up to that is, are you evaluating the findings of that strategy? So are we collaboratively working towards a strategy, and then are we evaluating that strategy? And so what they said was, we didn't do a very good job. We slightly met that measure with the examples we gave them last year. So what we have done to help improve in those areas, for the collaborative implementation of a strategy, it was the Medicaid expansion advocacy that we did over this last year and during the legislative session. That was not led by Lewis and Clark Public Health. It was led by the Behavioral Health Local Advisory Committee. There was a committee that was really focused on the continuum of care and access to services. And it was that coalition or that group of community members that said, we want to make sure that Medicaid expansion is reauthorized so that people have access to insurance. And we know that if they have access to insurance, that they will actually go seek the care that they need. And so that was the example that I gave in our annual report, is we worked as a community. And we actually worked as a community across the state of Montana to advocate for the reauthorization of Medicaid expansion, and it worked. The second piece to that was evaluating the findings of access to healthcare. And so they accepted one of our examples, but we struggled to give them a second example. So the one example that we did give them was, well, I'm sorry. We gave them an example of a collaborative effort, and it was our mobile crisis response team efforts. We're working collaboratively in this community to make sure that we have the mobile crisis response available for individuals that are having a behavioral health crisis. They have services that will go to them. We, however, didn't do a good job of showing that we evaluated that service. And so as we continue to work with St. Peter's Health, who is the service provider for the mobile crisis response, working to evaluate, it's tricky because you don't want to try to evaluate something when somebody's in crisis. And so trying to figure out what is good timing to evaluate that, because when the mobile crisis response team dispatches out to somebody's home in the middle of a crisis and you get them to stabilize, you don't want to, in the next breath, say, oh, and how did I do? So there's the coalition, the MCRT, the Mobile Crisis Response Coalition, which includes multiple community partners. They are really trying to think through how to evaluate how those services are being delivered in our community and start collecting. Most likely it will end up being a month, 2 months, 6 month touch point back with the individuals that they served, and then asking how that service, and if they had feedback for a way that that service can be improved. And so we are working with our community partners to do that better. And so in our annual report to the Public Health Accreditation Board, that is what I described. I described that we are working with our community partners to evaluate that service. And not only will we do it for that service, but when the Journey Home, which is our crisis facility, opens this summer, we'll be working collaboratively with our community partners to evaluate that service as well. So we should have actually 2 really good examples when we go to explain what we're doing as a community the next time. And then the other part of our annual report to FAB is they wanted us to just do some reflection on any one of the other standards that we wanted to choose from. And so, of course, I picked an easy one, and that was our community health assessment. We had, it's hot off the press as of December of last year, and we did a really, really good job with our community health assessment. And so I chose to share this new community health assessment as a part of our annual report. So those were the 2 kind of big pieces of the annual report that was submitted.
Okay.
Have not yet received, I don't anticipate receiving feedback on those 2 pieces until later in the summer. When we do, we'll look at that feedback and use it to improve. So yeah, but that was the update on the annual report. The accreditation lasts for 5 years, and each of those 5 years we'll need to do an annual report, and it will look different each year. So you never know what they're going to throw at us. We'll just take it as it comes, I guess.
Well done.
Yeah.
Okay, so we are a little bit behind. So would you like to let me know what you think we should prioritize time-wise?
Yeah, the measles update can be very brief. And then it's up to the board then to act on if you want to go into closed session for the evaluation. So
Okay, so we can skip the board training, or did you want to hit that quickly, or what do you think?
The board training was really connected to it, and I could really just do it in 30 seconds, and it's in your packet. I don't know what page. Page 38. I don't know what I'm going to do without you, Madam Chair.
We've been together a long time in various roles.
You're reading my mind.
No.
So on page 38 of your packet is the reminder of the governance functions of the Board of Health. And the one function that I wanted to bring to your attention today as part of your board training is oversight. And essentially what that board function says is that you'll evaluate and provide feedback to your health officer. So I chose this as your training today because that's what you'll be doing is when we go into closed session is really taking the time to evaluate me as the health officer and providing the feedback for improvement. And that's one of the aspects of oversight is ensuring that that you're keeping a touch point on the inner workings of the health department, and that you are providing me, who leads the health department, with the necessary feedback to do my job well. So that's all. Unless you had questions about that. And then the last item is just a measles update, and you all received the news release that we put out last Friday. Nothing like getting a call from the state health department on, at 2-3 o'clock on a Friday afternoon. And our public health nurse supervisor not being in the building. Or our communication specialist not being in the building. So what that said to me is that we were well prepared. We already had our protocols in place and all staff were ready to go. And so as soon as we got notification from the state health department that there was an exposure, pretty significant exposure that happened in the Helena area, we easily went right to work. So what we learned is that we had a visitor from another county to the Helena area on Sunday, June 15th, and visited a variety of businesses in Helena over the course of that day. TJ Maxx, Costco, Old Navy, Mackenzie River Pizza, and then the Town Pump on North Montana Avenue. And that the individual at the time did not know that they were sick with measles. They didn't know until they got back home again. But when we did the investigation, and the state, of course, was part of that because the individual was from another county. What we learned is that the person who visited was contagious in the time span that they were in our community. And so any individual, because of how contagious measles is, all you have to be is in the same physical space for 2 hours after that individual had walked through that space. So the individual was at TJ Maxx around 2 o'clock. So in any time between 2 and 4:30, anybody else in that space was exposed. And then similarly for Costco, Old Navy. So really looking at when that individual was in the space, what that 2 hour window is, and then putting notification out, because we don't know. We were able to directly connect with those business owner, the managers of those businesses, so that they could inform staff. But other than that, there's no way to know. So at that point, all we can do is put out public notification and let people then determine whether they were exposed or not. And if they felt like they were, giving them some instructions on what to do next. So asking the folks to either fill out our self-referral form on our website so that we can then be informed that they may have been exposed, or giving our hotline a call, then gives us an opportunity to provide a little bit of guidance on what to do. We also put that guidance right in the news release. We have it on our website. And essentially for individuals that have immunity, so either vaccinated against or had been exposed to measles as a child, those individuals can go about their normal daily activities and just watch for symptoms for about 21 days. But those that don't have immunity, we are asking that those individuals quarantine or not be in the public for 21 days and watch for symptoms, because it's highly likely, based on the data, that individuals who are not vaccinated or immune against measles will essentially get measles if exposed. It's that contagious. And so Those are the instructions that we put out as quickly as possible in this community. So within an hour, I don't know, I didn't time it, within an hour of the state health department calling us and giving us the information, our public health nurse had already started making phone calls to businesses and putting and then we put the press release out so that the news could pick it up and that the message could get out to the community. So within an hour, we were able to respond and get information out. So directing people to our website, helping people understand what immunity means, putting out that self-referral form. And then what Amber's done as our communications specialist since then is just continuing to kind of drop messages out to the public. How important it is to understand what your immunity is. And not to enter a medical clinic if you are having symptoms, but to call first because we don't want exposure to happen in the lobby of that medical facility or the medical staff to be exposed. So giving instructions on calling first, don't just show up. So she's been doing some ongoing messaging to help our community kind of understand what to do. So we've had a couple of reporters that have followed up on the press release as well and felt like we got some good coverage and that hopefully most people at least heard what was happening in the community. So at this point, it could take anywhere between 7 and 14 days before we understand if there's been a case that came out of that exposure. So we're waiting to see.
Can I ask a quick question?
Yeah,
Do we
absolutely.
have rough numbers of how many people we are currently monitoring? Like who self-reported or?
I don't have those, but I could ask Shelley. They're the ones that are getting that self-report form and then connecting back with those individuals. So there was a lot of phone traffic that came in with questions, but as far as exposures are concerned, they're just the businesses alone, the staff. There was a lot of staff within those that were exposed, not to mention the public. So.
And you said 7 to 14 days is when we might start to see something, which means roughly.
2 weeks after the exposure.
So that would be tomorrow.
We'll be coming up on that here this weekend.
Okay. Thank you.
Yep, could take up to 21 days, but we normally see, data shows us that between 7 and 14 days, individuals who are exposed will start to see symptoms. So I'm hopeful. We have fairly decent vaccine coverage in our community, but there is a percentage of those that are vaccinated that could get the measles, a small percentage, but with the measles vaccination is 96% effective. So there is a chance, but then those that aren't are, I worry most about the babies. I worry about the 0 to 1 year because you don't get your first MMR until you're a year old. So I'm pretty concerned about our babies out there that could potentially get exposed. So.
I very much applaud the super fast response. It was super impressive and I'm grateful to all of you. So
thank you.
I'm sure that was not a fun thing to manage, but thank you.
Yeah, it wasn't chaotic. And I think it was because we were ready. We had done the preparation necessary and everybody knew what to do. So, and it's not novel. So we know what measles is. We know how it functions. We know how it spreads. We know the data around it. So that helps to, keep a calm, cool head. Put information out.
Are you seeing people just coming in to get a booster just because? Are we seeing more general MMRs?
I don't know that we are.
By
That's
adults?
another good question. there's a couple of questions. I'll follow it. Yes, ma'am.
Jen, if you don't mind, I could jump in and just answer. Obviously, I'm up here,
Oh,
so I am exposed to a lot of it. I will just to go back to Melinda's question. We did have one person who was exposed and was unable to determine if they had ever been vaccinated. So they went through our whole protocol of registration, digitally, calling, parking in a special spot. A nurse went out with the protective gear and was able to immunize that person outside. So that was the only one that who reported an exposure who, wasn't sure if they were vaccinated. In regards to the other question, Shelley would be better suited to know, but we have been seeing a little bit of activity around getting their boosters, but nothing that seems like there's widespread concern.
Thank you.
Yeah, I can get with Shelley and get some numbers. And if there's been an uptick in MMRs and then how many self-reports have come in, and I can
It's
follow back
not
up.
crucial, I'm just
Yeah.
curious.
I
to
mean, I was
see.
just curious.
Yes, yeah, those are great questions and I'd be happy to follow up.
Okay,
Yeah,
well.
that was
thank you.
important. So thanks
That was
for
important.
letting me go along.
Yeah, of course. Okay, well, in that case, is there any public comment?
No, Madam Chair, there's not.
Okay, then we will adjourn into closed session for the annual staff evaluation.
And the county attorney's office made the note last year when we did this, that it should be an action item to close the regular meeting and move into closed session for this purpose. So that
Okay.
it's noted that the board chose to do that.
I would like to ask for a motion to go into a closed session to evaluate our health officer.
moved.
All right.
Second.
Thank you. All in favor, say aye.
Aye.
Any opposed? Hearing none, we adjourn.
Right, I will pause the recording and leave the meeting. Thank you.
I think